cousin who almost died of COVID. And I will tell you that she was 46 years old. She is 46 years old, very healthy, was in Atlanta. And, you know, part of what people don't understand about the situation is that, yes, while I think the racism is a public health crisis and creates pre-existing conditions for us, also when you start to think about what happens once you get the services you're supposed to have, right? So she goes to the hospital, they put her on a ventilator. They call her parents, who both live out of state, and say, we've done all that we can do for her. We want to take her off the ventilator. The parents are like confused. You know, they call us. We say, are her organs failing? Why would they want to take her off the ventilator if that's what's keeping her alive? If she can fight the infection, then she should be able to be taken off the ventilator. Then it's what do you mean they've done all they can do for her? They wouldn't talk to us. We ended up calling our friend Arta, a non-Black physician, who called and demanded to speak to the, we demanded too, but we didn't get very far. But he demanded to speak to the pharmacist, who was able to confirm for him that not only was she not given the medication they said they were going to give her, they didn't have the medication at the time that they said that they gave it to her. Mm-hmm. So he demanded that they give her the medication. As soon as she got the medication, she went from a palliative plan to a rehabilitative plan. And she's now talking and fine. So what people have to understand on top of the disparities in terms of who is getting COVID is who is dying of COVID and why. Literally, we have Arta to thank for my cousin's life. And that is not because we are not self-advocating people. It is because of racism. I don't know what else to say. The value of my complaint or my concern or my interest in what I want to see happening with my family member is not taken as seriously. And there have been several frontline health workers who've been talking about this. On top of that, many of the frontline jobs that require you to be in person, people I know who are bus drivers or who work for the city in some capacity who have to be out, that also it's going to exacerbate the numbers of people who are infected and who are. And then you look at the media and what the media chooses to portray as people who don't care, or they think, or who are on the bus and they're like, look at all these people in New York. These people have to eat. And so I know plenty of barbers and beauticians who are trying to figure out how to survive, and getting a stimulus check and deciding, do I pay my rent or do I buy groceries, is a really difficult decision to have to make. So when you have those types of decisions to make, you go, I'm just going to have to risk it and go to work. And so I think all those things creates an extremely devastating impact on the community. And at the same time, what I hope is that the community doesn't start to blame themselves, right? That we are unworthy of care, or that we don't deserve to live. Like, that's my ultimate fear, is that that's the messaging that comes to the children, is that they don't care about us and we don't matter, right? And so I think that when you look at something like COVID and who's dying of COVID, there are so many reasons why that's the case. And it's super devastating in communities. I've had two of my staff had people who died during this time, and they can't bury them, not in person. They can't have memorials. They can't. And again, this is just very difficult for us. It's for anyone, but for us culturally, these are significant, usually very spiritual or religious situations that they know that they can't process the same way. So it's just been extremely depleting on folks. And when I think about advocacy in the medical field, it's just really hard. We're advocating educated people, and we still almost lost my cousin. So it makes you feel like, and I think this is one point that I want to drive home for everyone here. When you're in the communities and people want to talk about poverty as a universal issue and not race, let's not talk about equity. We can start with race. Let's start with poverty, because and I tell people all the time, especially if you look at organ statistics, if you lift a white child out of poverty and you educate him and you put him in a nice environment, he will ultimately be pretty well off, probably be fine. You elevate a Black child out of poverty and you educate him and you create good mentors and opportunities for him. And then he goes to Harvard and he's bird watching and the police get called on him. So it's, so for me, you have to pay attention to the etiology of every problem, the root cause of it. You can't just try to change policy without changing hearts and minds.